Modern chemotherapy is a highly effective tool for targeting cancer cells. But because these medicines travel throughout the entire body, their toxicity can inadvertently disrupt your internal communication networks. A recent global review of medical data produced an alarming headline. 41% of patients reported experiencing chronic nerve pain. For anyone starting cancer treatment, that sounds like a near coin flip chance of developing long-term suffering. To understand the actual risk, we have to look closely at this diagram. The large circle represents everyone receiving chemotherapy, but the data doesn't apply to them. It shrinks down to a much smaller subset of patients who were already diagnosed with nerve damage. The 41% statistic only applies to that smaller circle. That specific nerve damage is called chemotherapy-induced peripheral neuropathy, or CIPN. It is a direct result of certain cancer medicines chemically injuring the nerve fibers over the course of treatment. Misinterpreting these statistics creates unnecessary panic. When you look at the exact data, you gain the ability to work with your doctor to balance aggressive cancer treatment with the preservation of your long-term physical health. Your peripheral nervous system is basically an expansive biological highway. It carries sensory signals from your brain and spinal cord out to your skin, muscles, and extremities. This animated map of the nervous system shows why taxanes and platinum-based drugs cause problems. They systematically injure the longest nerves first. Because these pathways reach so far, you'll notice damage in your fingertips and toes before it creeps upward. The presentation of that damage varies widely. Patients with painful CIPN report burning sensations or sudden electric shocks. But others develop moderate to severe CIPN, which is characterized by heavy numbness, a loss of coordination, frequent dropping of objects, and an inability to maintain balance. Nerve damage does not always equal physical pain. If you assume neuropathy only means a burning sensation, you might ignore severe clumsiness or numbness that requires immediate medical attention. This graph plots chemotherapy dosage against symptom severity to illustrate coasting. Nerve symptoms can worsen even after chemotherapy stops. Symptoms lasting 3 months are chronic. But notice the 3-month mark. The chart splits into multiple trajectories. Chronic means persistent, not automatically permanent. You will find plenty of over-the-counter supplements like B vitamins or acetyl L-carnitine marketed as nerve support. Clinical studies show these have no proven reliability to prevent or reverse CIPN, and some may even interfere with your cancer treatment. Prescribed medications like duloxetine currently offer the strongest clinical evidence for pain relief. Even then, the average benefits are modest. There is no magic bullet. Because there is no guaranteed chemical reversal for nerve injury, you cannot rely on reactive miracle cures. Managing this condition requires a proactive medical strategy. Without a reliable medication to prevent CIPN, the single most powerful tool you have to protect your nerves is your own voice. If you report mild tingling early, your oncology team can evaluate the symptoms and adjust your treatment plan before the nerve damage becomes severe. If you wait until you can't button your shirt or feel the pedals of your car, the window for early intervention is already closed. This balancing scale illustrates the ongoing clinical calculus your doctor performs. To save your nerves while fighting the cancer, they have specific mechanical adjustments available. They can delay your treatment cycles, reduce the overall drug dose, or swap the nerve-damaging medicine for an alternative. While you undergo treatment, reduced sensation requires practical safety adjustments in your daily life. Remove loose rugs to clear trip hazards, improve the lighting in your hallways, and test your bathwater temperature carefully, because your skin may not accurately register the heat. Never suffer in silence under the assumption that severe pain or numbness is an inevitable requirement of chemotherapy. Actively monitoring and protecting your nerve health is exactly how you survive cancer with your quality of life intact.